here to talk to you about what's happening with Zika. There's been some news around the Zika virus today back in the States. Before I get to that, though, I just want to tell you that I'm in Salvador, Brazil. Part of the reason that we're here is we've been investigating what's been happening with Zika for some time now, and it's this area, really Bahia, which is the state that we're in, which has been the epicenter for this Zika epidemic. You may remember, people have been talking about this for some time, but it wasn't really until last fall where you started hearing about babies that had been born with their mother had been infected with the Zika virus, those babies born with a condition known as microcephaly. You probably heard about it back then, you've been wondering about it. Well, with the Olympics starting at the end of next week, there's a lot of concern and a lot of questions. But most immediately, for people back in the United States, in Florida today, we have learned that there's Zika infection that has been transmitted locally. You're going to hear that term a lot. Zika transmitted locally. And I wanted to take just a minute before I start answering some of your questions to sort of explain what that means. By the way, you get an idea here looking at Salvador. Salvador is the third most populated city in Brazil, but it's also one of the poorest. And that is one of the concerns when it comes to Zika as well, is that areas that are poor, it could be because they don't have as much air conditioning, they don't have as much mosquito control, they may not have as good nutrition. Those things all seem to make an impact, not just in acquiring the infection, but also in understanding how significant that infection is going to be. But again, going back to Florida quickly, we know now that there are four people who have the Zika infection. And what is so relevant about them is that none of them had traveled to a place where Zika is spreading, or Zika is spreading locally, nor was this a sexually transmitted virus. They hadn't had sex with anybody who has come back from one of these places. So if you haven't traveled and brought Zika back, and you haven't acquired it through sex, the only way that they believe these four people acquired it was through a mosquito bite. Now, why is that relevant? That means that the virus is now spreading locally. A mosquito likely bit somebody who had the Zika virus in their blood. They may have traveled somewhere. That mosquito then is flying around. After a period of time, that mosquito can then bite somebody else and actually give another person that Zika infection. So that is what likely happened. It seemed to have happened within a 1 square mile area in Florida, I believe just north of Miami, in a particular zip code. What is happening on the ground is they are going door to door in these areas, trying to get samples, even urine samples, trying to use anything to try and find out who may be infected with this virus, try and get an idea of just how significant the scale is. They're also finding mosquitoes, seeing if they're tracking down mosquitoes, finding them, and seeing if any of these mosquitoes in fact have evidence of the Zika virus in their system. That would be more evidence that this is spreading locally. That's what's going on now. I do want to point out, again, before I start taking any of your questions, that this isn't entirely surprising. We knew that this was likely to happen in the United States, in the continental United States. We knew when it did happen, it was most likely going to happen in an area where the climate was very similar to what we experienced down here in the summer, in Brazil in the summer. Hot, breeding ground for mosquitoes, areas where there may be standing water, all those things make a huge difference. So if you look at South Florida, you look at South Texas, you look at Louisiana, many of those southern areas, particularly around the Gulf, this was expected to happen. The big question now is what's going to be done about it. What's being done about it again is they're trying to actually do this testing, going door to door. We're talking about what it means for blood donations. We know that there's been a question of whether blood donations would be halted in the particular county where these four patients live, the two counties where these patients live, or they'll just continue to screen for Zika virus in blood donations as they've done. But obviously this is going to cause some concern for a lot of people living in these areas. But I do want to point out again that this was not entirely unexpected.
So Dave wants to know if you're here in Brazil to cover the Olympics, and what are some of the preparations and concerns around that?
Dave's asking about the Olympics and why we're here. Yeah, we're here in part for the Olympics, but I'm actually covering the story of the Zika virus and the water issues. Those are two big health issues. This is a very unusual Olympics in terms of medical preparation for lots of different reasons. We live in a different world, a world where there is concerns about terrorism, obviously, mass casualties, but there's also this concern about Zika for the athletes, for the spectators. How exactly is this Olympic Village going to prepare itself? And also the fact that this happens to be sort of the epicenter of where we really started to recognize this epidemic in this part of the world. Remember, Zika's been around for a long time. Zika's been around, I think, identified back in the mid-40s, 1947. But it started to make these jumps just over the last couple of years and eventually really spread a great deal here in the Americas, specifically South America. But again, the news today being that it does have evidence now that it's starting to spread in North America, specifically in the state of Florida.
Chris and a lot of other people are wondering if you could remind them of the symptoms of Zika.
Chris is asking about the symptoms of Zika, and I'm glad you asked this because this is both good news and bad news depending on your perspective. The good news first. The good news is that for the vast majority of people, they're not going to really have any symptoms or very mild symptoms. In fact, to put some numbers on that, about 20% of people will have any sort of symptoms at all. 80% will have no or very mild symptoms. So that's the good news. It's obviously been of the greatest concern for women who are pregnant, and particularly it seems to be worse for women who acquire this infection in the first trimester of their pregnancy. The concern is that they could have a child who has a birth defect known as microcephaly or other birth defects as well. But for the vast majority of people, they're not likely to have any symptoms. The bad news part of that, this is a little bit counterintuitive, is like I'm here down in El Salvador. If people do get the infection but never have any symptoms, they can obviously travel then around the world, travel back to the United States, in the case where I live, and that could actually, they could actually become sort of carriers. They could be that person that a mosquito might bite, get the virus into the blood, into the mosquito, and then possibly at some point go infect somebody else. So you may not get sick at all, you may not have any symptoms that you pay attention to, but you could still potentially have the Zika virus in your system. And we also know that for men in particular, the Zika virus can live in the semen, for example, for up to 6 months, they're saying. So you could be carrying the virus again with no symptoms and possibly pass it on to your partner even up to 6 months after getting the infection. So that's why you're hearing all these recommendations for how you should, what you need to do if you're going to a country like Brazil and then coming back to the States.
Building off that, Ruth wants to know the pregnancy guidelines around this. If someone's looking to get pregnant, not necessarily if they already are, but a lot of people want to know if they're thinking about starting a family, should they wait?
Yeah, family planning is a big deal. And you may remember when we started talking about this. By the way, I just want to point out, you see all this over here behind me? There's a hospital right over there. That's a hospital where that's where they're being cared for. It's in this area where some of those first children with microcephaly were found and found to actually have had this relationship to the Zika virus. So this is where a lot of this happened, in this particular area of the world. If you are pregnant already, the recommendation is very simple. It's got to be safe sex. It's got to be protected sex for the entire duration of the pregnancy. That's been a recommendation from the very start. Now let's say somebody's down in an area where Zika is spreading. There are 60 countries where Zika is now spreading. If you're in one of these places and then you go back home, let's say to the States, and you're thinking about starting a family, the recommendation is that if you know that you've had an infection, if you know that you've actually gotten the Zika infection, 6 months for men before it is safe to have a pregnancy, because you could transmit the virus to the woman during that 6-month period. That's the concern. If you haven't had any symptoms and you've had no evidence of the Zika infection, they're still saying 8 weeks before you would have unprotected sex with your partner. So it's these are tough guidelines, and in a lot of countries around the world, including El Salvador, they've been saying no, just don't get pregnant. They're basically saying stop all family planning for the time being. You can imagine how difficult that is to abide by in many of these countries. First of all, there's hardly any access to contraception. There's abortion is illegal in these places, certainly not offered. So it's really challenging. If you imagine if you're a young woman who who's recently become pregnant in a country where Zika virus is circulating, it is a really tough situation in terms of how they need to think about their lives and what they want to do to be as safe as possible.
So taking pregnancy out of the equation, Jeff wants to know, how do you best protect yourself from this particular mosquito, the Aedes aegypti?
Well, the Aedes aegypti is the mosquito that we're talking about. And again, I want to point out the Aedes aegypti is a mosquito that already circulates in the United States. The mosquito's already there. It has been responsible for some minor outbreaks of dengue fever, for example. So we knew at some point that because the mosquito was already there, that likely the virus, once that mosquito bit somebody with the virus, it was going to start circulating. But look, it's pretty warm out here, and I'm wearing long sleeves. It's one of the simple protections. Insect repellent, obviously a simple protection. I will point out, and this may be obvious to people who've traveled a lot, but this is actually the cooler time of the year here in Brazil. So the summer in the United States is the winter down here. So actually you're seeing a lot less mosquitoes, many fewer mosquitoes than you had over the summer months. So it's not as risky in that regard. But I will say that the basic precautions do make a difference. Long sleeves, insect repellent. And even back in the States, living in homes that have screens on the windows and have some sort of climate control, that can make a huge difference as well. And it's also part of the reason that I think we're not going to see a massive outbreak of Zika in the United States like we're seeing in this area right here behind me.